It's fairly well known in Ontario and certainly across Canada that people who suffer from mental health and addictions issues or homelessness have a great deal more trouble accessing the healthcare system, and as a result struggle a great deal more with their health. It's the barriers to accessing healthcare for these people can be logistical and can be related to resources, but they can also be related to the attitudes of those who provide care, and it is the latter that I'd like to talk about today. Quite often, healthcare providers are unaware of some of the assumptions that they're making. Very good professionals, people who are good people, making assumptions about other people and certainly about the illnesses that they have. I think through people's stories, we sometimes can learn the impact of those assumptions and how they lead to less than desirable situations in terms of people accessing care. The best way to learn about these things, in my opinion, is people's stories, and I'd like to share a few stories of my own, from my own family, and a story from someone else who've experienced those sorts of attitudes and the impact it had on their health. In the summer of 1993, I got a phone call from my mom, and she said to me, "Diane, your dad is sick." Now, my parents lived in a small town. I grew up in this same small town. And my parents were divorced, but still had very caring relationships about each other. And she called to let me know that he was sick. And my mom was a very respected nurse in this town, a well-loved nurse, a wonderful woman. And she was very concerned about my dad. And what she said to me was, and I had known that he had been struggling with not feeling well and pain and a variety of issues. And what she said to me was that she had received a phone call from a nurse in town who worked in Emerge at her town and had said, "Alfie was in here last night, and I just want you to know that you'd be proud of us. I just told the doctor who was working that night, who by the way was a locum, not a local doctor from town, I just told him that he was the town drunk and that he was just there to get drugs. And the doctor just told him to go home and didn't really help him at all." And my mom had been aware that my dad was having trouble accessing care in the town. So I'm going to cry a little bit as I tell the story because it's a very painful situation, which I want you to know that piece too, because it's important that people understand how painful this is. She called me and said, what she said on the phone call was, "Your dad isn't going to get care in this town. Nobody's will help him. He just is having a really hard time accessing any sort of care because he has a reputation of being, as the nurse said, the town drunk." Now this was an odd sort of moment for me because I had never thought of my dad in terms of labels. I had never thought of him as an alcoholic. I'd certainly never thought of him as the town drunk. And I will say that I was so shocked to hear that this had happened, that he had not only been turned away from care, but that a healthcare provider was very proud of the fact that they had done that. What my mom said to me was, "Can you get him in as soon as possible to see one of the doctors that you work with?" I contacted one of the really amazing doctors that I worked with in the town that I lived in. And I said to him, "You know, my dad is really unwell and he's not getting much help in his town. Will you see him?" And the doctor said, "I'll see him tomorrow." I went and got my dad and I brought him to this doctor that I knew, and the doctor checked him over and spent a lot of time with him. And he said to me, the doctor said to me later, he said, I was with my dad, and he said, "You know, Diane, people don't lose that much weight in a short period of time, nor do they nor do they be unable to work or do any of their normal daily functions unless there's something terribly wrong that is new. And so he did some tests, and then he called me later in the day and he said, we aren't able to fully diagnose him right now, but he has some blood tests that would indicate that he probably has a small cell carcinoma of the lung. And then he said to me, he's been sick for quite a while. He told me about how long he's been trying to get help, and he's been sick for quite a while. And he has very little time to live. At that time, the doctor connected him with wonderful oncologists who did their very best to provide palliative measures to stop just even some of the suffering that he'd been going through over the months, but was still going through on a daily basis. And they did a great job, but never really totally got his pain under control. And he died a few weeks later. It was a really hard time for me because it was so painful to watch someone I care about suffer. And he, small cell carcinoma of the lung is a pretty serious cancer, and he may not have been able to have been treated, but he certainly could have had an end of life that was a lot better than what he experienced. And it was also difficult because I belong to the healthcare profession, and I'm proud every day of what we do as healthcare providers, and nurses, doctors, and all the others that we work with every day. But it made me so angry and so embarrassed to think that sometimes we don't do it right. We don't get it right. And that some of our most vulnerable people are denied some of the basics of care that you and I wouldn't be denied. Because we aren't homeless, although my father wasn't homeless, but we don't have addictions to alcohol or drugs. We would be maybe treated differently. And I've spent a lot of time since that time as a healthcare provider thinking about what happens in the healthcare system and how many people face an inability to access the care that they should be able to access. And have I ever prejudged someone? I've spent a lot of time thinking about this. Now, after my dad died at the age of 57, fast forward 10 years and I am at work, a 12-hour shift in a birthing unit, and I became very ill very suddenly. I'd been experiencing some mystery abdominal pain that was very difficult for me, and it happened one night about 2 o'clock in the morning in the middle of a 12-hour shift, and I basically passed out from pain in my abdomen, and the nurses took me downstairs, and I was in Emerge and had blood work done, and they were looking at what might be going on abdominally, and my blood work was not quite, it didn't make a lot of sense to the doctor. And so the doctor that was on call came in and he said to me, "Are you a drinker?" And I said, "No. I mean, I have a glass of wine with my friends, but I'm not, I don't have a drinking problem." And he said, "Maybe a big party last night?" And I said, "Well, last night I did a 12-hour shift right here through the night, slept today, and then I'm back doing a 12-hour shift tonight." No. And he said, "I'll bet you want some drugs." And I will tell you something. At that moment, I was so sick and had so much pain, and I am a nurse. And I said to him, "Yes, I want some gravel, and I'd really like something for pain." And it was an interesting situation because I knew when I said it that was just sealing the deal and proving that what I was doing in Emerge was looking for some drugs. And I have never felt less respected or more helpless in my whole life. And 12 hours later, I was fine, and was later able to be diagnosed by some really great physicians who got to the bottom of what was going on. But all I could think about was my father and the fact that he wasn't okay in 12 hours and faced increasingly difficult situations with no one willing to help him. I'd like to share with you another story from someone who has also lived this and currently can face some prejudices of her own. And I'd like to share her stories in the hopes that all of us open our eyes a bit more to the people that we encounter every day and are a little bit more conscious of the fact that every single person needs to be treated with respect equal to the next person. Can we get started?
Yeah.
Okay. So today I'm here with my friend Penny, and I'm going to talk to Penny a little bit about her experiences in accessing the healthcare system and how various things have impacted her ability to be healthy, related to the attitudes of people who are working within the healthcare system. So, Penny, first of all, if you could tell us a little bit about yourself, your story, and so that we get to know you better.
Okay, I'm 43. I live in Barrie, Ontario. I have ADHD as well as mania, manic depression, bipolar, and I take methadone on a daily basis, and that's about it. I have 3 children, and I'm in a long-term committed relationship with Bud. He's the dream of my life. He's everything to me. And I, like I said, live in Barrie, and I love Barrie. It's a wonderful city, and I love almost everything about it. I'm an artist. I paint. See, those are my paintings. That's about it.
Those are Penny's paintings.
Now that's a bit more about me.
Penny, can you tell me a little bit about the methadone? The why and how you got to the point where you take methadone?
Okay, my husband and I have been on methadone for about 5 years now. We take it every day. And it started because we went to the dentist at a nearby place in Barrie, and the doctor, for pain, prescribed us Percocet. And within a couple of weeks, we were hooked on it. And then he cut us off cold turkey, and we started buying Percocet from. And then we went on methadone to deal with our addiction. And now it's been 5 years. We've been clean. All we take is methadone every day, and our regular meds. We don't use any drugs. All our drug tests have been clean for 5 years.
Okay. And maybe, Penny, if you shared with us, if it's okay with you, just a little bit about your youth.
Okay, I was adopted. I'm an Aboriginal woman, half Aboriginal, half Irish, and I was adopted by an Irish family who tried to love me, but they didn't love me as much as they loved their own children, and it was very painful for me. And I got bullied a lot in school, like crazy bullied, and I would cry every day and get sick every day, and I got put into remedial learning because I was so emotionally distressed. And actually, I'm in advanced learning now if I was still in school, but I was in remedial at the time, and it was awful. It was a horrible treatment.
Penny, do you have a family doctor?
I do not. No.
Okay. Have you tried to get a family doctor?
I did years ago, but it's very difficult. So.
Why do you think that is?
Well, because of my background, because I've been a cutter previously, and doctors don't like that. They really don't like it at all, and they think I have a bad attitude. And I don't have a bad attitude, but a long time ago I did, and it's carried forward in my record. And
okay, so so you think that you don't have a family doctor because family doctors really don't want to take you on as a patient?
Yeah.
Is that what you're saying?
I think they think I'm going to be too much work.
Okay. So when you are feeling unwell,
yeah,
and you need to access healthcare,
yeah,
where do you go for that?
Depending on the degree of unwell, I either go to the health clinic at Wellington Plaza or I go to the hospital.
Okay, so what is that like? What do you do when you go there to, is there anything you have to do to make sure that they will provide you with care?
Absolutely. For the clinic as well as the hospital, we lie about our address because the address we live at is a crack house, and people assume when you live here that you're a drug addict and that you're actively using or seeking drugs or stuff like that. And the assumptions they make about you just are so difficult to get around So we just say we live at an address we used to live at, and we just use that address. If they need to reach us, then they can't, but they can reach us by phone, and they don't come to your house anyways. So.
Right. So when you prepare to, so you have to take some special preparation to go.
Oh yeah, we get on our best clothes, like we dress up, and I put pearl earrings in, and get my hair done nice, and wear makeup, and my husband wears a tie.
All of this while you're feeling sick and looking for
absolutely,
help.
yeah.
Okay.
I have asthma, so I have to get inhalers every 3 to 6 months, and it's the same procedure every time. Getting up, getting dressed. We get there 2 hours early, so we can get in first, so he's not in a bad mood or something.
Right.
Yeah.
What are you able to access in terms of regular checkups and screening for well people would get, just the normal preventative health care?
Absolutely nothing. We don't do anything.
Nothing.
I haven't had a pap smear since I had my last child, and he's 16 now.
Okay.
Yeah.
So why is that?
I guess because you probably need a doctor for that.
Yeah. Because you don't have a good family doctor or nurse practitioner.
Yeah.
Okay.
I think there was a nurse at eFry before, and I might consider trying to contact them again and see if I can still see them through them. But then my husband doesn't get a nurse, so it's not fair to him if I get treatment and he doesn't. Right?
Yeah. But it would still be a good start.
Yeah.
And then hopefully there would be, also, you would be able to find something for Bud as well.
Yeah.
So tell me about just how difficult it is to access care sometimes.
Well, I needed a psychiatric treatment. I knew it. I was manic. I was way over the edge, and I was out of control. And this is where my husband and I met. But I called 911 and said I was going to hurt myself and all that. But I didn't really intend to hurt myself at that time. I just wanted to get taken to the hospital so I could put in the psych ward so I could get the treatment I needed. And my husband, at the time, he wanted treatment and they wouldn't help him. So he went in to rob a store. He just kept his hand in his pocket. He didn't have any weapons. He said, "I'm robbing you," and she gave him, I think, $80. And he went outside the store and waited for the police to come because he needed treatment.
So he knew that to access the health care that he needed,
that he had to do a crime.
That he had to do something was really unfortunate for himself.
Yeah.
To get there.
That's how we met.
And that's how you met. So that's a good thing.
Yeah.
So can you tell me about a time or a person in the healthcare system that treated you really well?
Yeah. There was a security guard in the Barrie Hospital. Her name was Michelle. And she had a friend, Victoria. The two of them just treated me so well. And they were like, "Okay, we're not going to tie you down. We're not going to restrain you. We're not going to hurt you. We're just going to give you the best treatment we can give you." Well, they watched me because as soon as I get to the hospital, they just get a security guard for me because of my background. So
when you go to the hospital, you are automatically assigned a security guard.
Absolutely, yeah.
And you had a security guard who went sort of
above and beyond.
Yeah, to make sure that you were well cared for and that you were treated as people should be treated.
Yeah.
If you could change something about the healthcare system and the attitudes that cause you to have such difficulties accessing healthcare, what would you change?
I would educate people on methadone and that some people are trying to abuse drugs, but some people aren't, and you can't just decide everyone is, right? Like all the patients, like the patients who aren't on methadone, some of them are trying to get drugs too, right? And you don't just assume that about them. And it's unfair to assume it about me because I'm not seeking drugs at all when I've been there for treatment. And they just let us wait so long and see other people before us and just treat us bad. And when I said one time, I said, "I'm not here to get drugs," she goes, "Well, then what are you here for?" I said, "Well, I'm here to seek treatment, And we ended up leaving after waiting 8 hours that day.
I guess, Penny, what I'd ask you in closing then is if you could tell us something about you that people don't know, that you wish they knew, especially when you go to the healthcare, access healthcare. What would that thing be?
Well, I'm a gentle person, and all my, the police form when they pull up about you, the brand new name, whatever, says I'm a violent person and dangerous, and the hospital says I'm dangerous, everyone says I'm dangerous, and I'm not dangerous, not at all. At the time when I got those records sent to me, they'd just taken away my children, and I was acting out violently towards myself. I was hitting myself, and they took that to make me a dangerous offender. I had never been in a fight in town. I've never been in a fight with hospital staff or anything. I've never done anything aggressive ever. And they just write I'm aggressive, and I'm gentle. I'm not, like, I get my feelings hurt just the same as anyone else, you know. I cry when I leave the hospital just like anyone else, you know, and they don't think I'm like that, you know. I want them to know I'm a woman and I'm gentle and I'm moody because I'm a woman, not just because I'm manic, you know.
Right. Well, thank you very much, Penny. I think your story is a reminder of just how much you are like me and like other people, and that we have an obligation to treat you exactly the way we would expect to be treated within the healthcare system. So thanks for sharing your story with me today.
Thanks, Anne.